So unlike Steve, I can't do this without notes. I'm very impressed by his ability to speak without looking at any paper. So thank you all for coming. It's really exciting for me to get to speak to you tonight. Normally I'm somewhere behind an email when I get to talk with you, so it's nice to actually be in a room with everybody. This AGM is a chance for us to deal with some of the key kind of governance issues that we need to address each year. But also it's an opportunity to reflect back on the year that we've just finished and to look forward together to kind of envision what the next steps will be. I came to the division in early 2012, just after it was formed. Right away, we hired Nicole DeHoop, our admin assistant, and we both worked directly with the 7 active inaugural board members to build a new organization that was going to engage Victoria's family physicians. Right away from those early days, there was a huge appetite for change within the board and also in the first cohort of members. We were all energized by the chance to build doctor-to-doctor links and to cooperate to improve both physicians and also patients' experiences of care. It was a bit daunting, a bit meaning very, to consider the scope of the work ahead of us, but there was enormous hope and enthusiasm and no shortage of members who were willing to step right up to start working and doing things to make things better. So fast forward to now, the spring of 2014, the end of our second full year of operation. Our membership has risen beyond all expectations to 340. We're one of the largest divisions in BC. We're second only to Vancouver. Our infrastructure has developed and matured. The startup work that consumed most of our first year is really paying off now, and we have systems and processes in place that allow us to work both efficiently and effectively on a day-to-day basis. The scope of our work has expanded in breadth and depth. Even in the last 6 months, it has just taken off like crazy. Our community building committee, the first committee that came out of the division, is as active as ever. This year, it continues to host monthly Dine and Learn events, the annual barbecue at Willows Beach, and also this year, as Steve already mentioned, they launched a Welcome and Transitions Mentorship Program, as well as the Physician Resource Booklet, which will, I'd like to say, cross my fingers, I don't want to jinx it, but within a month should be up online and searchable for you as a database. The committee is now working to develop welcome and recruitment materials that showcase why Victoria is a great place to be a GP. Our 4 working groups that Steve talked about met regularly through most of 2013 and altogether engaged over 20% of our membership. A mass meeting that brought all those working groups together in this exact room, almost exactly a year ago tonight, helped to guide the board of directors to develop its 3-year strategic plan. Actually, there it is, which in turn, the strategic plan in turn helps then to direct the ideas that are generated within the working groups. And we've built a lot of our work, specifically our work around a GP for me, around the results of the working group process to ensure that that initiative, like all of the initiatives that we do, responds to local GPs' needs and concerns. We've also spent time this year as part of a GP for Me exploring the issues that are facing our community through deeper research into both physician supply and patient demand. And so, for example, you may remember spending an hour or more filling out a survey last summer, and that was that comprehensive physician survey, and Dr. Becker is going to talk about that in a few minutes. There's also a write-up in the annual report that describes some of the results from that. And that's helped us to understand who you are, who we are, as we build our programs. We've yesterday just closed a patient survey that was distributed widely throughout the South Island region, and we did that in partnership with the South Island Division. And we're now wrapping up an in-depth community engagement process where we've worked with NGOs and others in the community to learn more about the primary care needs in key demographic groups, and particularly among the city's most vulnerable populations. 2 of those populations are frail seniors and people with mental health and/or addictions concerns. Division members prioritized both those groups in our first member survey back in the spring of 2012. And multiple data sources that we've looked at since affirm our commitment to improving care for these people. The Care of the Elderly Working Group has focused its efforts so far on developing an evidence-based model to improve family physician involvement with long-term care, and we'll be prototyping this in the fall. The working group is now going to turn its attention to addressing ways that we can support frail seniors who are living in the community. The Mental Health and Addictions Care Access Working Group has confronted many complex issues, most of which point toward the value of collaborative and shared care models. And we just released a scan, which is out on the table in the front, of mental health and addiction services in the city. And the Mental Health Working Group in general has been really maximizing its opportunities to engage across disciplines with mental health and addictions providers throughout the health system. This has been particularly important in its work with Island Health to develop a proposal for a South Island crisis clinic. And that crisis clinic will include mechanisms to support GPs who are treating patients with mental health problems. So supporting GPs is actually really at the heart of every single program that we build. It's really about helping you to do your work and to do your work in a way that is satisfying and manageable for you as an individual. And this has certainly been the motivation behind the Recruitment, Retention, and Practice Coverage Working Group. This group is part of the division's effort to bring more GPs to Victoria and also to assist GPs to cover their practices so that they don't burn out and so that working here is in fact an attractive prospect. So we're really, really excited to announce that we're developing a comprehensive coverage support program. The details about that program will be coming soon. In fact, we're going to have an event on June 24th where we are going to talk in more depth about that and hopefully get some feedback from members around what you want in that program. But really, we've been listening to members for the last 2 years talk about the challenges of finding a locum, finding coverage. And so we're happy to say that as of now, immediately, we're able to offer you free posting access to locums.ca for a 6-month trial period. And along with that, we're able to offer you some coaching. Dr. Sandra Lee is working with us, and she'll be able to offer you some coaching to make sure that when you're posting ads for locums, they are as effective as possible. A committee drawn from the Practice Coverage Working Group is going to build this full suite of support services, and like I said, we'll be looking to you for more direction on this as the months go on. So stay tuned for more information about that, and make sure that you have a look at the handouts in your package about this developing program. We're also working to make sure that the hospital has accurate GP contact information. That is way harder than it sounds, so we're working on that. We are also working on some projects to ensure that there's collaborative problem solving with the emergency department. Our next phase of transitions in care we expect is going to focus on discharge planning. And finally, we're very excited also about work that we've just begun with the Ministry of Health's Emergency Management Unit. Last year's AGM, we had Dr. Graham Dodd speak about emergency preparedness for physicians. And the feedback after that talk told us very, very clearly that you want local strategies to help you respond if there were an emergency, a disaster, or other surge in demand for primary care. So we now have a members working group on this and a solid partnership with the Ministry's Emergency Management Unit to develop a practice resiliency tool for individual physicians and clinics. And we're going to be working with the Ministry as well as Island Health to develop a coordinated health system response so that should there be a major disaster, 2 things can happen. 1, you can continue to practice if you want to, which has all kinds of benefits, including continuing your income. And the other is that you can continue to provide care in the community, because we know from evidence that GPs provide a major service to patients, both in the immediate aftermath of a disaster and in the time following. So this is really important for us to have. It's an exciting opportunity. It helps Vancouver Islanders become more self-sufficient in an area where we really need to be looking after ourselves. And it breaks new ground in Canada. We have with the help of our partners in the ministry and the Emergency Management Unit, we looked at lots of literature which tells us that communities benefit when physicians are disaster ready. And so the Victoria Division, it's sort of exciting to say, we're actually the only division or the only group of physicians in all of Canada that's organizing this way. So we stand to make a real mark in this area. So the division's work is expanding every day and really beyond what any kind of brief summary can articulate. As a result of that expansion, we've grown from a staff of 2 people, way back when, to a full operational team that can respond to the division's needs for strategic leadership, for project management, administration, and more. But the most important thing is that member physicians continue to drive the division's work. We are really proud to support an organized and connected community of family physicians who are working on behalf of their patients and on behalf of their peers to improve the health system. I think I speak for everyone when I can say that we feel like we're gifted with an opportunity here to experiment and to really go out on a limb to see if we can make some changes that are going to improve the situation for both patients and physicians. So we keep an eye on the division's progress toward defined goals, but we're also as committed to the process of doing that as we are to the product. It's critical that we achieve our intended results, so I'm not sort of downplaying that, but it's also equally critical in an innovative organization to be brave and to be open to untested and unexpected things. In our first 2 years, that was the approach we've taken, and that has enabled us to influence health policy and health service delivery decisions. It's enabled us to support our members in developing their own leadership capacity, and that's where you see yourselves as engines in the division's board, in working groups, in steering committees, et cetera, et cetera. We're starting to see the division weaving itself into the fabric of family medicine in Victoria. More and more, we find members turning to the division proactively for help with problems that you're experiencing in your practices, in the health system more generally. We have people coming for professional development, for peer support, and for opportunities to change the system of care. So not just to put Band-Aids on it, but to actually make fundamental changes which are going to result in permanent improvements. This is dependent on a combination of strong member engagement and also working partnerships. All of our work responds to the core problems and priorities that members have identified, but it's the partnerships that allow us to envision and implement creative solutions that really just wouldn't be possible if we were acting alone. So we're developing important relationships with other divisions of family practice, with the Doctors of BC, the Ministry of Health, local NGOs, UBC and UVic, and Island Health, and all the combinations therein. We're very, very pleased to welcome and share our celebration tonight with folks from all of those groups, and I thank the people that we work with day to day in all of our partner organizations. I also want to take a second to thank our truly exemplary operational team. I have the deepest gratitude to my colleagues who really make this division thing happen every day, and I'm just going to read their names, and it's alphabetical, so there's no other kind of bias here. Kristen Atwood, Gina Sisman, Nicole DeHoop, Gina Delamare, Sarah Healing, Becky Litt, Katrina Park, Crystal Sawyer, Cindy Story-Sote, Chrissy Tamori, and Sarah Tudway-Keynes. So it's a lot more than 2 people now that make this happen. I also want to say a very, very genuine and deep thanks to our board of directors. They pour so much time and energy into this division, and they are really an absolute delight to work with. I've worked in other nonprofits, and this is truly both boards have been the best boards I've ever worked with. They are outstanding, and I feel just completely lucky to get to be their ED. And finally, my ultimate thanks, and there's some crossover here, is to the members. To put it really plainly, you guys are a really great group. You're fun, you're dedicated people, you're interesting. Every time I go to a meeting, even if I'm tired going in, I always feel energized coming out, which really tells you something. I go to a lot of meetings. And when I meet with the members, that's when it's actually enjoyable and fun. So thank you. The last 2 years have been amazing. Watching you grow, watching your organization grow has been a privilege, and I'm really looking forward to the next 2 years. So everyone, please enjoy tonight. Never hesitate to be in touch with comments or questions, and you don't need to be kind. You can just tell it like it is. So thank you very much.